Hi, my name is Madison Wenz, and I'm here for my presentation on chemotherapy, the chemistry behind treating diseases. So what is chemotherapy? Chemotherapy is an aggressive drug treatment used to target and kill rapidly growing cells. This is typically associated with cancer, but there are many diseases that chemotherapy is used to treat. Those include multiple sclerosis, lupus, and rheumatoid arthritis. The American Cancer Society states that chemotherapy is systemic, so this means that it attacks all fast-reproducing cells in the body, not just a specific area such as a tumor. This means that chemotherapy circulates throughout the body, getting anything that may have spread off from a certain area. Again, the American Cancer Society states that there are over 100 types of drugs used for chemotherapy, but there are still four main common drugs. Those are erlotinib, imatinib mesylate, irinotecan, and sofranib. These are the main drugs used in chemotherapy, but there are also many other drugs that are used to make a more personalized treatment and work better for different cancers. The American Cancer Society again states that there are three main goals: to cure, control, and palliate. Curing is to destroy the disease and hope that it never comes back. Controlling is to stop the disease from spreading and to either hopefully shrink the tumor or to eventually get to the point where you can cure the cancer. This is typically used after surgery. If a tumor is too risky to get the entire thing, people use chemotherapy to get the rest of the tumor. And then palpitation. This is when a disease is at a very late stage and there is no hope to cure the disease. This is used to ease the pain of the patient and to improve their quality of life. The National Cancer Institute states that there are 7 ways that chemotherapy can be taken/given. That is orally, through pill, capsule, or by liquid, intravenous, which is an IV, which is injected into the vein, injection, which is like a shot into the muscle or below the skin, intrathecal is into the tissue that covers the brain and spinal cord, intraperitoneal, injected directly into the peritoneal cavity, which is the stomach or intestines, intraarterial, which gets put into the artery that leads directly to infected area, as in a tumor, or a topical, which is a cream that can be absorbed through the skin. Because chemotherapy is the target and killing of rapidly growing cells, there are good cells in the body that rapidly grow. So when good cells, healthy cells, start to die off, you are left with side effects. So according to the National Cancer Institute, common side effects are fatigue, hair loss, nausea, mouth sores, diarrhea and constipation, and easy bruising and bleeding. Historical development. Newsmedical.net states that in the early 1900s, Paul Ehrlich studied drugs to treat infectious diseases. He coined the term chemotherapy, which is using chemicals and drugs to treat diseases. And he also believed that his treatment would be able to treat cancer. Shortly after, they were able to transfer tumors into mice and experiment which chemicals and drugs would be able to cure the diseases that they have. Right afterwards, they found the first chemotherapy chemical that was able to treat cancer, but it was completely on accident. So during World War II, a U.S. naval ship was attacked, causing all the soldiers to go overboard. There was a chemical on board called nitrogen mustard. This was leaked into the water that the soldiers had to swim through to get on land. And all of the soldiers had severe health issues and or died. So they did autopsies on the dead bodies and found that the chemical went after and killed all the fast-growing cells in the body. They realized that in small amounts, this chemical, nitrogen mustard, would be able to hopefully cure cancer. So shortly after, Sidney Farber found aminopertorant, which is a drug that blocks chemical reactions in cells that are needed for DNA replication. And after that, serotonin antagonists were found in the 1990s. They are nausea receptor nausea receptor blockers in the brain, which allowed people to go through chemotherapy treatment and not have to deal with all of the side effects anymore. So chemists and biochemists involved in chemotherapy. Paul Ehrlich, as stated before, was the founder of chemotherapy. He is the one who coined the term and realized that drugs and chemicals can be used to fight diseases. Sidney Farber founded immunoproteins and is the father of modern chemotherapy. His work led to many other chemotherapy drugs that we know and use today. Sahachiro Hata worked under Paul Ehrlich. He studied the plague in Europe, and he was very concerned on how contagious it was and how it spread. He also found the first chemotherapy drug that was able to treat syphilis. And lastly, George Hitchings and Gertrude Elon, they produced drugs that are used to fight leukemia, malaria, and many infections. This information was brought by the Nobel Prize. So the future of chemotherapy. The Motley Fool states that the goals for the future are to personalize treatment for each patient. So this is to know and have a set treatment plan for when a patient comes in. This is to normalize the treatment of cancer and hopefully reduce the side effects such as hair loss and nausea. Involvement beyond chemistry. So the American Cancer Society states that physical therapy is a great hand-in-hand field used for chemotherapy. It is used to increase muscle strength, boost patients' immune systems, ease side effects, and increase blood flow. The increased blood flow to the body helps patients to recover faster. And because they can no longer move as they typically did, chemotherapy allows them to stay in good shape. Cancer.net states that counseling also is a very large part of chemotherapy. It helps patients manage stress and respond to emotions during the time of distress that they are in. Because side effects are greatly linked to mental illnesses, counseling is a great resource for everybody that undergoes chemotherapy. PubMed.gov states that the government is a very large resource in chemotherapy. They create almost all the funds for the research. They have education programs and support programs to teach people about chemotherapy. And lastly, Community Cancer Center states that nutrition and dietitian is a very large part of chemotherapy. They set up meal plans, food plans to keep the patients nourished. It keeps their energy, their strength, and their nutrients up. Societal impacts. There are many positives, as you may have guessed, about chemotherapy, which include life expectancy going up, the potential to cure cancers and many diseases, and to help ease symptoms and improve patients' quality of life. But there are negatives. So not everybody is able to afford chemotherapy, and there are many side effects that have been correlated to mental illnesses. So in conclusion, chemotherapy, again, is the aggressive treatment of using drugs and chemicals to attack and target fastly growing cells in the body. Because of this, there are good and bad cells that do get eliminated. When good cells get eliminated, you are left with many side effects, which cause distress throughout the body. But now that there are over 100 different types of drugs that can help, there is supposed to be a more personalized treatment for every single patient, hopefully eliminating some of those side effects. The goals are to cure, control, and to palpitate chemotherapy. And there are many people that brought chemotherapy to where it is today. So Paul Ehrlich, Sidney Farber, Sahachiro Hata, George Hitchings, and Gertrude Elon made chemotherapy what it is known as today. And there are many other fields involved in chemotherapy, like physical therapy, government, nutrition, and counseling that work hand in hand to make the person at ease while they are undergoing chemotherapy. So lastly, here are all my citations. If anybody has questions or would like to further their education on chemotherapy, use these citations. They're really great. But thank you for listening to my presentation.